I'm Nick Ferran. I'm a consultant trauma and orthopedic surgeon specializing in shoulder and elbow surgery. I'm passionate about delivering awake shoulder and elbow surgery under regional anesthesia where appropriate, and have interests in treating conditions such as frozen shoulder, rotator cuff tears, fractures and dislocations around the clavicle, shoulder, and elbow, and nerve problems such as cubital tunnel syndrome and carpal tunnel syndrome. If you have any of these problems or want a consultation about your shoulder or elbow, please get in touch with our practice management team. The clavicle can fracture in 3 places. The most common place for it to break is in the middle, often called a mid-shaft clavicle fracture. The next most common is the outer end of the bone, called a lateral clavicle fracture, and very rarely medial clavicle fractures can occur. With mid-shaft clavicle fractures, the most common cause for this is a fall on the outstretched hand. And this can either be low energy or in some cases high energy, such as coming off a push bike, a motorbike, or snowboarding. These are some of the most common causes I see in my clinic. With lateral clavicle fractures, the most common cause is a fall directly onto the side of the shoulder. And again, these can be due to low energy injuries or high energy injuries. With a clavicle fracture, patients will experience extreme pain. Often there'll be bruising and swelling, which can spread down the chest, and there may be a visible deformity, either tenting of the bone under the skin, or sometimes shortening of the affected shoulder so that there's an asymmetry between the shoulder lengths on either side. There sometimes can be pain going down the arm, and if swelling and bruising affect the nerves in the neck, there may be pins and needles in the hand, which need to be investigated as an urgent matter. But by far and by large, the most common symptom is pain and deformity. Most clavicle fractures are managed conservatively and will heal without an operation. They're quite often managed in either a sling or a brace to try to help support the weight of the arm to prevent the fracture from displacing. And this also provides pain relief. If we are treating a fracture in a sling, the sling is often used for up to 6 weeks, but early movement of the shoulder can be started. We also encourage use of the hands so that if patients are working in a desk job, they may be able to return to work quite soon and start using a computer as soon as pain allows. Some clavicle fractures require an operation if there's significant displacement or there are high energy injuries. These often require a period of immobilization after surgery, again in a sling. And patients, again, are encouraged to use the hand and to start mobilizing the shoulder as early as possible. So desk-based jobs can often be returned to quite soon. With both conservative and surgical management, any weight through the arm can displace the fracture, and therefore manual jobs that involve heavy lifting are usually avoided because this fracture can take up to 3 months to heal. So if you're doing a manual job or heavy sporting activity, it usually takes about 3 months to return to these. Lots of patients ask when I can return to driving after a clavicle fracture. And for most patients, this will be after the sling has been removed and they're able to control the car comfortably. So in most cases, whether the fracture is operated on or not, the time before you can return to driving is usually a minimum of 6 weeks. Most fractures take up to 3 months to heal. Surgery doesn't speed up the rate of healing, but can help with pain relief and can help to restore the anatomy and prevent long-term problems from the fracture healing in a bad position. So If you have a clavicle fracture, it's important to get it investigated and have a discussion with your surgeon about whether this needs to be operated on.